All right, YouTube. This Detroit's HPTV coming to you early this Friday morning, back with another video. Another day of our government or the government being shut down. And it's creating a lot of havoc with the common man, with their administrative procedures being hindered because nobody's in office. But why are the Democrats actually shutting down government? You would think that it was in behalf of their constituents, their base, or some other type of policy that they want to implement for the best welfare and good of the American people. But no, that's not why the Democrats are shutting down government. They're shutting down government for guess what reason? The same reason they've been doing everything this political season, to protect the rights of illegal immigrants. You have illegal immigrants who they want to get free Medicaid and Medicare. And that's a part of the bill that the right and the conservatives won't vote on. So this is where they're gridlocked. But a lot of you don't understand that these people are willing to throw this country into total chaos and let the American people suffer just so they can protect the illegal immigrants who are going to be their new voting bloc. But without further ado, let's get off into this clip. So I want you to see the receipts about why they're actually shutting down government. And this for fair usage under the 1976 Copyright Act for education and commentary. And shout out to Greg Foreman at the Black Conservative Perspective. Look at this.
Insurance for those that should never been in this country to begin with.
Well, so
and I know Chuck Schumer says that that's not.
No. I looked into it. I know what you're talking about. I just want to explain to our viewers. So there is a provision that the Democrats want to get rid of, and part of it is Medicaid reimbursements, emergency Medicaid reimbursements to hospitals, some of which does go to undocumented immigrants using healthcare there to those hospitals. Some of it is also for people who are in this country legally but are not citizens, people who are refugees or people who have temporary protected status.
Well, actually, it goes further than that, because in the One Big Beautiful Bill, it has a line saying cut and fraud, waste, and abuse, specifically saying that Medicaid and Medicare benefits cannot go to an illegal alien. Underneath this CR, that it's going to cost the taxpayers $1.5 trillion to keep government open for 4 weeks, it specifically, by line, X's that part out. So right, it's more than just reimbursement. This is actually allows them to have Medicaid or Medicare inside, if it's state funded or if it's federal funded. So it goes much farther than just reimbursement to hospitals.
Can I say one thing, which is that people who are in the country illegally cannot get these subsidies that we're talking about?
Sure they can.
No, they can't.
No, they can't. It's federal law, Scott.
Who do you think pays when they go to the emergency room? It's the Medicaid emergency program.
Going to the emergency room is not getting an Obamacare subsidy.
You guys are conflating. You guys are conflating these issues. You're conflating these issues.
And you're being dishonest with
the subsidies are a separate issue. The Medicaid program cuts are a different thing.
Right, but I'm talking about
Medicaid
subsidies.
and the Obamacare stuff are two different issues. And I said the subsidies may get negotiated over time, but what Democrats want to do is roll back what the Republican Medicaid reforms were. They want, look, I don't understand why everybody's so mad. For time immemorial, Democrats have argued that it's good. It's good for illegal immigrants to get Medicaid. Every candidate for president in 2020 raised their hand for it. In the big, beautiful bill debate, they argued it was good policy. I can't believe there's an about face in the Democratic Party on it today.
Hold on. I got a question for Karen, but Scott, I will say, people who are in the country illegally also can't get Medicaid.
Sure they can.
Law.
Sure they can.
They can't get Medicaid.
They also
Medicare,
can't register to vote. They also
Obamacare
can't register to
subsidies.
vote, but we just found one in Maryland who was running the Des Moines school system.
Oh, my God, one?
I mean,
Scott.
I'm telling you, you guys say these things can't happen,
I'm
and
just
then they
saying,
happen.
Scott. I'm just saying it's federal law, and
you can run cover. You can run cover for it if you want, but they do get federal tax money.
Facts.
They get
Karen,
federal
can I ask
tax
you,
money. Ask Jake. He had it on today.
I'm just saying it's against federal law to
Okay,
do
yes,
that.
it is.
Karen, can I ask?
Boy, oh boy, oh boy, oh boy, oh boy. So once again, we got to talk about Democrats who are struggling right now with the propaganda that they are putting out to the mainstream liberal media, claiming that Republicans are lying when Republicans say that Democrats have shut down the government so that they can force the Trump administration to give taxpayer-funded health care to illegals, right? Democrats swear up and down that this is a lie, and they get pissed off and they get mad with the mainstream liberal media who wants to push this propaganda on behalf of Democrats. They want to lie on behalf of Democrats, but Democrats are the ones who are actually lying, and you know this because the mainstream liberal media can't help but to be at least somewhat honest about what Democrats are actually fighting for when you talk about the Medicaid provisions, the reforms in the big beautiful bill that Democrats want to reverse, that ultimately end up benefiting or funding healthcare for.
I'm the father of Leon, who's participating in the clinical trial, and she's been
Legal immigrants.
You know, Republicans say what you're really fighting for is taxpayer dollars for, as they put it, illegal aliens. I know that's not strictly true, but there is a provision.
Excuse me, not strictly true.
It's not true directly, but
out lie. It is a flat out lie.
The way that they frame it.
There is nothing in Medicare that permits one undocumented immigrant to get $1 of assistance.
Senator, if you'd let me finish the question.
Of course,
Senator,
I'm sorry.
Sorry, in the Democratic counteroffer, the proposal for funding, there is a restoration of Medicaid benefits for certain non-citizens that it had been taken away in the big beautiful bill, as the Republicans put it. Republicans don't think those people should be getting health care on the taxpayer dime. I'm not asking on the merits. Politically, putting that in there exposes you to this talking point, this lie, as you put it. Why put it in there? Why is it worth it?
No, what's happened?
Now she has to explain why they put that provision in the bill to restore the illegal immigrants with some benefits. You know, it's a lot of double talk and there's a lot of fear-mongering coming from the left. But they are the main culprits behind this governmental shutdown, and you're seeing why.
That what we're saying is that whenever hospitals give care, what is going to be the level of reimbursement? And the Republicans said it's going to be a low level. The Democrats said we just want to go back to the level it was before because you're going to bankrupt hospitals. You're going to put rural hospitals out of business. The Republicans and the Democrats plan, nothing changes the number of undocumented immigrants who still get care if they show up bleeding and unconscious at an emergency room. There is absolutely zero difference. The difference is whether or not hospitals, who under laws that date back to Ronald Reagan, may provide emergency care to anyone who's unconscious, will actually get reimbursed at a very low level that will put the hospital ultimately out of business potentially, or at a higher level. The Republicans, there is no change in the number of undocumented immigrants who get any help under what the Democrats want. Look,
Senator,
what we're looking for is help for people who are going to get pushed out of nursing homes,
Senator,
help for people who are at home and relying on home health aides. That's
Senator,
what this...
Senator, you're lying. You're a lie. You're a damn lie. Okay? Democrats, specifically in their counter proposal to Republicans, restore provisions that allow illegals to get taxpayer-funded health care benefits, right? Democrats can't get around that. And you know it's true because even in mainstream liberal media, they have to admit, right, that they're struggling to not say outright that Democrats are pro-funding health care for illegals, but they have to admit that, yeah, what you guys put in your counter proposal to Republicans, that's effectively what it does, right? Like, that's how you know the Democrats are lying. That's how you know the Democrats are full of it. That's how you know that this is more gaslighting from the Democrats, right? Because even the media is like, why are you guys putting this proposal in your legislation and then coming out here and saying that you don't want taxpayer-funded benefits for non-citizens or legal immigrants, whatever you want to call them, regardless. We're talking about people who are not citizens, okay? That's what we're talking about, okay? Regardless. Why are you doing that, right? Because essentially, you are just giving the Republicans a win. You're giving them a W, right? You are legitimizing their accusations. So, again, it's just funny because the mainstream, they're trying to basically coach the Democrats and say, hey, look, we can't even come out here with a straight face and gaslight and BS on your behalf, right? Because you are putting provisions in your counter proposals that would fund healthcare for illegals, right? It's just so hilarious to watch the mainstream liberal media struggle to explain to the audience why is it that Democrats are doing this, and then lecturing the Democrats on, you probably shouldn't be doing this because, again, you are legitimizing what Republicans are saying, okay? It's really fascinating. But the honest to God truth is that Democrats do believe in illegals getting taxpayer-funded healthcare. This is what they believe in. They all have fought for this, okay? Democrat healthcare plans have always been about allowing illegals to get healthcare. And this Fox host, Lawrence Jones, is going to do an amazing job at basically providing proof and evidence that that's exactly what Democrats are not only fighting for today, but they've been fighting for healthcare for illegals for years now, right? For years. This is a position within the Democrat Party. This is what they're for, okay? And this Democrat senator, her name is Jeanne Shaheen. She's from New Hampshire. And let's just say she is not going to be too happy with Lawrence Jones when he presents to her proof and evidence that this is exactly what Democrats support. So without further ado, let's go ahead and get into it.
Part of the sticking point is that Section 2141 part of the bill. And that's the funding that a lot of Republicans are pointing to, that when you look at it, it can go to illegals in emergency hospitals and things like that. But Democrats are saying that's not true. But when you actually dive in the numbers there, that is a sticking point, and it is true, right?
Well, we know that Medicare, Medicaid, and the Affordable Care Act health insurance market all prohibit anybody who's illegal from getting access to health care. So if there are places, what you're referring to is a provision that was put in place back when Ronald Reagan was president that said hospitals and emergency rooms had to treat people who showed up and needed care. So the idea that this is an effort to make sure that illegal immigrants can get health care is just not true.
Senator,
I think all of us want to see any fraud and abuse that's part of the program addressed. You know, I was a governor. I worked very hard to make sure we got the best we could from every single tax dollar. And that's what I think most of us want at the federal level as well.
But Senator, to that point, and you know this, and you're right that rule exists, and it was passed by Ronald Reagan. But during the big, beautiful bill, there was debate on this, and there were some modifications to that to remove, when it comes to some of those loopholes, they call it the California loophole, when it comes to some of the undocumented immigrants, the illegal immigrants, and some of the people that aren't Americans just yet that may be going through the asylum process. They took that out during the big, beautiful bill. And it looks like Democrats are trying to stick that portion back in. So, you know, we can go back and forth on the small little details, but in fact, people that aren't in the country legal.
Well, that's not a small little detail. I would disagree.
Well, let me explain what's going on here, right? Because the devil is in the details. Basically, there's a provision that says that, hey, you know, when you have somebody come into the hospital and, you know, they are uninsured or whatever, right? Some of these hospitals, they get reimbursed, right? They get reimbursed for treating some of these individuals. Now, the problem is that when you have illegals or people who are non-citizens go to these hospitals and, you know, they get treated, these hospitals are getting reimbursed for treating non-citizens, right, and illegals, okay? They get reimbursed under Medicaid or whatever. And Republicans got rid of that. Now, Democrats are arguing that, well, see, rural hospitals aren't going to be able to survive if they don't get reimbursed for treating non-citizens and illegal immigrants, right? That's their argument. However, again, what Democrats don't understand is that if a hospital is incurring costs for treating illegal immigrants, that's on the hospital, right? They decided they want to treat the illegal. If they're not doing it for free, then the only thing they can do is charge the illegal immigrant. That doesn't mean that taxpayers need to foot the bill in order to help the hospital with their costs. No, that's not how it works. So again, it's a loophole. It's like a backdoor loophole. It's like, yeah, technically, illegals are ineligible. But again, Democrats have figured out backdoor ways in order to get the illegals benefits, right? That's what they do. And that is what the Trump administration is trying to stop. They're trying to stop the Democrats from taking advantage of loopholes within the law in order to get taxpayer funds to help treat illegals, right? Or to give health care to illegals.
I agree with you. I think that big, beautiful bill was passed with totally Republican votes.
Right.
I'm not interested in seeing that we provide health care for illegal immigrants. What I am interested in seeing is that people who are going to get pushed out of their health insurance because we're not willing to extend those tax credits are really going to be hurt, and that's going to affect the whole health care system. So I think we can agree we all want to deal with waste and fraud. We all want to make sure that it's American citizens and legal Americans who are getting access to health care. The illegal immigrant is just a red herring that's designed to try and prevent people from talking about the real issue, which is how do we provide health insurance for people in this country?
You know, I say a little detail. You said red herring, but the fact is, Senator.
No, I'm agreeing with you. Listen, I'm agreeing with you. You're trying to make an issue where there isn't one.
No.
We agree.
Senator,
illegal immigrants should not be getting access to the Affordable Care Act marketplace.
100%, Senator. But what I'm saying is that members of your party are making
well,
this
I
an
can't
issue.
speak for members of my party, and I don't think you're right. I think you're making it an issue. Vice President Vance is making it an issue, but I haven't heard anybody in my party saying that illegal immigrants should get access to the health insurance marketplace.
I'm so glad you said that. Actually, I have some tape of your Democratic Party members saying this on the debate stage, so they've all said it. Let's play the clip.
A lot of you have been talking tonight about these government health care plans that you've proposed in one form or another. This is a show of hands question, and hold them up for a moment so people can see. Raise your hand if your government plan would provide coverage for undocumented immigrants.
Okay. That was all of them.
Senator, that's literally every member of your party, from moderate to more progressive, that have said that in the past. I've seen them all on the table.
I beg to disagree with you. I have not said that in the past. In New Hampshire, we do not provide health insurance for illegal immigrants. We have never done that, and you're just wrong. So the question right now is, what are we going to do to ensure that we're not kicking 24 million Americans raising their premiums for health insurance, doubling those, and kicking 4 million Americans off of their health insurance? And that...
Yeah, so again, what you have here is just more BS from Democrats. Again, look at this, bro. Look at this. How many of you support health care for illegals? Right? All of them raised their hands. Every single Democrat on stage raised their hand. This is what Democrats believe. And they're trying to convince us we don't support health care for illegals. That's a right-wing conspiracy. When their mouths are moving, they're lying. Right? I'm just saying, like, that's basically the Democrat Party at this point. They just lie. They just lie. And they don't care. They will lie to your face. And then try to pretend you're the crazy person for calling them out on their lies. But we have clips. We have proof and evidence. That's exactly what they support. Also on top of that, you talk about the Obamacare pandemic subsidies, right? Again, we're not in the pandemic. Why do we need that? We don't need it. Now, the crazy part about it is that these subsidies actually largely benefited upper middle class families. These are subsidies for the upper middle class.
Senator, I'm interested to know what you say to your colleague in the House, Jared Golden, a Democrat from Maine. He says that this government shutdown is the result of hardball politics driven by demands of far-left groups that they're making on Democratic Party leaders to make a show of their opposition to President Trump. The shutdown is hurting Americans and our economy. The irony is that it has handed more power to the president. Now, he says this fight is ostensibly about health care, and he notes that he opposes the Medicaid cuts, wants to extend the tax credits. But then he says some of my colleagues in the majority party have reasonable concerns going to high-income households. Normal policy disagreements, though, are no reason to subject our constituents to the continued harm of this shutdown. Do you think he's wrong?
That's a whole lot of gibberish. The most important thing, again, is that what I know for a fact, 24 million Americans are going to have their premiums increasing starting November 1st.
You think that this is the result of hardball politics driven by demands of far-left groups? That's gibberish?
No, I think that whole conversation, everything you just said, to me doesn't really matter. I know what
so
the
you don't
fact
think
is.
that Chuck Schumer, for example, is acting
Americans
because he might face a primary from
AOC? 24 million Americans, no, I don't think. I think that's BS.
Right? So you're not talking about subsidies for the poor, okay? When you talk about Obamacare, you're not talking about subsidies for the poor. You're talking about for the upper middle class, okay? You're giving out subsidies to people who don't need subsidies. And also, again, to people who shouldn't get subsidies at all, illegals.
And that's the urgent issue that we need to address. And people on both sides of the aisle are talking about how do we work together to address that. That's what I think we need to do.
The Washington Post says that they feel like the Democrats are falling into the president's trap. And this is going to give him the opportunity to cut other programs that he wanted to do during DOGE. So do you feel like you're falling into a trap laid by the president?
Well, I think the president has been cutting programs and federal employees since he took office from day one. So this is nothing new. The urgent issue for us now, and we need to come together on this, and I would hope that the president would work with congressional leadership to bring people together. That's when I was governor. When we had an issue that we disagreed on, I went to my Republican legislature and I said, let's sit down, let's figure out how we can address this so that...
I'm going to stop there because she's talking about the president should bring people together. They're not going to be able to ever come together at this point because they're not being truthful and honest about what the bill is. They know right now that the bill is the problem and why the government is shut down. And they know that the spending is directed towards illegal immigrants and things that the current administration don't want to fund. So everything else is rhetoric. You sit back and they want to act like it's virtual signaling or it's millions of people that's going to lose their benefits when in all actuality, when it comes to the benefits, that's coming from the illegal immigrants that shouldn't be here in the first place. So tell me what you think about the story. This is Detroit's HPTV out of Detroit. Like, share, and subscribe. As always, salute to our patriots. Keep your head on the swivel. Peace.